Thank you, Mr. Sandeep. Good morning, good afternoon, and good evening. Welcome to the 1006th day of continuous and uninterrupted Zoom session of IFPS. Let us start today's program with a silent prayer for 1 minute. Thank you. Today our guest is Dr. Hubert De Silva, M.Sc, B.H.M.S, 36 years of experience, Chief Editor, IFPH, online magazine, moderator at IFPH webinar. The subject is Management of Cardiac Problems with Homeopathy. We all know that Hubert is a well-known person, is an artist, as well as a physician, and of course, homeopathic physicians are artists also, because it's a science and art in homeopathy. So, well, on behalf of IFPH, I welcome Dr. Hubert. You can have the platform for next 40 minutes. So, to you.
Thank you, Dr. Manoj. Can you hear me?
Yes, of course. Please.
Thank God. Because all the time my mic is go somewhere. Thank you. We are all in a good mood because we were celebrated the days. Our hearts are very much happy. And now I want to share my screen. Okay. Okay. Can you see that?
Yes, yes, please.
Okay. Now, for your heart will always be where your riches are. It is a word from scriptures. For your heart will always be where your riches are. This heart is not talking about the heart of our muscular heart. This is the heart. It is the invisible heart everybody have. Whenever our heart is filled with joy, we say that my heart is fulfilled with joy. A person, a small baby or a child, an innocent child. Now children are not innocent. So the former days, we may say that children are very innocent. The innocent heart, they may have innocent heart. They are always joyful and they never having sorrows in their mind. They are always depending their parents. They know that they will get food. They will get shelter. They will get everything from their parents. So they are always depending their parents. Whenever they become larger, bigger, their ages are going up. That time they will think independently. That time their sorrows will come. When they becoming mature and mature, and they have to seek their own life. They have to find out how to live. That time they may have problems. They may have troubles in their heart. So we have to keep a good heart, both muscular heart and the invisible heart. Let us see. The heart, it always beats from whenever we born. Before that, it started beating. How it is beating? Here we can see that some part of what is our heart? We can see here. The shape of the heart. There are so many things inside the heart. The intrinsic conduction system of the heart. Here we can see that superior vena cava, inside it, there is sinoatrial node. Pacemaker, we may say that it is the pacemaker. From here, the current is passing. It is an autonomous body. It's SA node, we may call it as SA node. From here, the generated power, the heart works. From there, it comes to here, the AB nodes, atrioventricular node. From wherever here, whenever this part is contracting and dilating each and every time, whenever it starts from here, the other part will, the other section, that is the AB node, it may start functioning, it may act, it may produce current, and it may go to other part. Here it made two branches, bundle branch, we call it as bundle branch. The current from here to here and come to here, and the whole heart will function, these fibers. This is like an electric generator. From an electric generator reaches here, and the muscular body will act and work throughout our life, from our birth to end of our life. Whenever it ends, it may stop. So we should keep the heart in a normal position. It is not possible. If you have a deep sorrow, it may affect the electrical system. If one person is always living in a sorrowful life, if he leads a sorrowful life, these electric system will always damage the current. The required current will not get that time. The heart may function slow. It may become slow and slow and slow. The blood flow from the heart to lungs and to the different parts of the body will be reduced. So there will be problems. So we have to, how we can make it the heart make, we have to keep the heart, the sinoatrial nodes and the AB nodes and Purkinje fibers should be clean. Always must be make it clean by exercises, and using homeopathic medicines may give you a good heart. If you have any problems, we can. Normally, most of the doctors are using cartridges as a medicine to clear the sinoatrial node if there is any problem. Digitalis is another medicine which can be used to regenerate if the functions are reducing that time. Gelsemium, aconite, these are the medicines we can use and think about in the first stages, or in any stages we can use, but whenever the person, if a person is coming with a blockage of this AB node, SA node, that may be in a condition, it may, if it is not functioning, means it does may occur at any time. So these are the things we have to, these are some of the medicines which are mostly used: aconite, gelsemium, carbovage, China, veratrum alb, digitalis, ibris. These are the medicines we can think. Spigelia. These are the medicines we can think in whenever there is a condition. Amyl nitrosum, another medicine. These are some of the acute medicines we can use immediately. Whenever it touches the tongue, it may act. That is what we can see in aconite. Aconite is a wonderful medicine. If I told you that if they are living in a very sad condition or a depressed condition, that time, very fearful persons Arsenic alb, very fearful persons, arsenic alb in higher potencies, we can use 1 these are the conditions. But we have to say, well, we have to go through the other parts. We know that blood vessels consist of arteries, arterioles, capillaries, venules, and veins. Vessels network deliver blood to all tissues in a direct and regulated manner. Arteries and veins are composed of 3 tissue layers. Basically, every part of our heart having blood vessels. Heart itself needs good circulation. That is, whenever we think that where should we should have much blood supply. That is the first part is heart itself should get good blood supply. Otherwise, it won't. This is the blood vessels. We can see that how beautifully God created these blood vessels. Elasticity, the artery having different walls, endothelium, smooth muscles, connective tissue, and capillaries where arterioles. These are the anatomy of artery. Each and every small, we cannot see it through our microscope. Here also, these are the layers there will be. That much. Whenever what is the difference between using an allopathic medicine and homeopathic medicine? Homeopathic medicines will go through all these parts. Whenever we make a studies in homeopathy, it is not easy. It is not laboratory. Laboratory examinations we can do as like allopathists are doing. We can see the results, everything. But whenever what is functioning, what is the changes happening in while we are using homeopathic medicines is that we should have an electronic magnetic study and a microscopic study, electronic microscopic studies, and it may clear only atomic level studies only explain what is happening in homeopathy. So it is very cost, we cannot afford the cost of studies. So that should be developed. That must be done. Here we can see that a valve. This is the valve of a blood vessel. Each and everywhere there are valves. Small vessels and large vessels having valves. Whenever the blood goes up, that time it may close. Whenever there is we can see that there is edema or swelling. That time the lower parts are, if it is swelling, where we can see that there is edema. That time these blood vessels are not functioning properly. That is why there is coming back the blood to the dependent parts. So a person, whenever we see a person, a doctor must always look each and every person's leg. If a person, the legs are edematous or some swellings are there, we can find out that we should understand that the person is not healthy. Dependent parts. This is always like that. Dependent parts, there is collection. Whenever a dead body, if one person is died, that time what happened? All the blood from the upper parts will come to the lower part. Gravitational force. Against the gravitational force, we have a power, we have a vital force. Against the gravitational force, if a strong person, if having a good vital force fulfilled person, that his body will work. Even though the gravitational force is 9.8, the body will act against it. We can overcome any condition, we can overcome. But if the vital force is weak, that time the body fluids will come depending on their dependent parts, that is the legs. Here, blood vessels. There are So many, so many networks we can see. This is the condition. So when common heart conditions, unstable angina. Unstable angina can be undiagnosed chest pain or a sudden worsening or existing angina, heart attack, heart failure, arrhythmia, abnormal heart rhythms, valve diseases, high blood pressure, congenital heart disease conditions, inherited conditions. In addition to that, smoking, drinking, eating cholesterol, fat, more fat content, which cannot be digested properly. It may all circulate in our blood vessels, and it may somewhere it may adherse, and the condition will worse. If nowadays we can see that most of the people, those who are white collar works they are doing, they are only eating, and becoming bigger. That heart may bigger. Heart may, the size of the heart may increase. That is what we can see in fatty degeneration of heart. Liver, fatty degeneration of the liver. Fatty degeneration of everywhere. Normal artery is like this. When this is the lumen means the hole. Narrowing of artery, how it may be narrowed. Now we can see that lipid deposit, or it may call as plaque. Coronary artery, it may, we know that heart was supplied with coronary vessels, and it may sometimes or most of the time, there may be chances of more adhesion or deposits are forming of the heart muscles, heart blood vessels, and it may lead to serious conditions. There are so many stages. Blood vessels, heart is becoming, the color of the heart may get changed. If the fatty degeneration of the heart or the lumen of the blood vessels in the heart, the coronary vessels, this is the blood supplying vessels, which may becoming more and more fat is adipose. At that time, the blood flow through that blood vessels will be reduced. These are the stages. First stage, that time a small area may be, in the stages may be becoming more and more, and last we can see that here the blood will not go there. That time, myocardial infarction, we may say that myocardial infarction. If there are so many precipitating factors are with it, say cigarette smoking and eating, not digesting food. That time, this is on area. If it is more and more area will be affected, that time heart will be blocked. Coronary artery or atherosclerotic heart disease, that affects the arteries to the heart. Valvular heart disease, that affects even the, I told you that even the valves having blood supply, the valves may be stenosed. Stenosed means it may becoming hardened. That time, the blood vessel valves will not act properly, and there may be leakage of the valvula. That is called, that affects how the valves function to regulate blood flow in and out of the heart. Cardiomyopathy, in another condition, that affects how the heart muscle squeezes. It will not squeeze. It should squeeze, and it may release and dilate and congest. It must be like the heart muscles. There are three types of the functioning of the heart, this round type, jumping type, the three types of movements are there. Heart rhythm, the another part is cardiomyopathy, then heart rhythm disturbances, it called arrhythmias that affect the electrical conduction. I told you that SA node, AB node, and the electricity supply of the heart, that may be have any disturbances. That time, the arrhythmias we may call the lub-dub sound will not be there. There may be more than lub-dub sounds, otherwise lub-dub, some intervals. After that, lub-dub. This is the condition. Next, another one is heart infections where the heart has structural problems with develop before birth. That is congenital heart diseases. Congenital heart diseases. That time, children may have some problems. We know that syphilitic persons, we may give that syphilinum medicine for congenital heart diseases, or if the parents having congenital problems. If the important thing, very important thing, the lady who conceived should be always lead a good life, a happiest life. Otherwise, it may itself cause congenital heart diseases of the new child, the new birth children. So that is why now psychiatrists are saying that the ladies who is conceiving should have a good, lead a peaceful life. Down syndromes. Down syndrome are one of the main problems causing by. I saw a person, I know a couple. They are jet black persons, jet black, but their children are, all of them are very fair, very beautiful. So I wondered how these parents are looking very black. They are very dark and not much look, not so nice, not nice, but their children are very fair, white, and they are beautiful children. I could not understand how it has happened, but I found one thing: the parents are very loving each other. The product will be nice if the parents are loving. Lovable parents have good children. That is why God, you may say that God binds the couple. We should not break. If the couple are very loving, the children will be good products they can produce. So that is another thing beyond our understandings. Here we can see that other heart. These are some of the conditions. Myocardial infarction in that stage, there is calcification and everything. It can, whenever we are using homeopathic medicines for some time, I found that so many cases having this, we can regenerate the cells, if even though it is damaged, because there may be regeneration and the calcification. I am not saying that all cases, but I found that many heart arrhythmic persons also having after getting treatment, they have good heart and good rhythm, the normal rhythm they could. After the treatment, I have seen many cases. Now, left ventricular hypertrophy usually develops gradually. You may experience no signs or symptoms especially during the early stages of the condition. As left ventricular hypertrophy progresses, you may experience shortness of breath, fatigue, chest pain, often after exercising, sensation of rapid fluttering or pounding heartbeats. We call it as palpitations, and dizziness or fainting. Sometimes they may faint. Some ladies, I have seen, ladies are more sudden dizziness and fainting. Sometimes because they think that the other problems may be. But if there is any numbness of the extremities, hand, legs, and I told you that the color of the leg, we should always watch the color of the leg, the extreme parts of the body. If the cold hands, while we are checking a person, if they have cold hand and sweating, their legs are very cold, that time that persons are more prone to left ventricular hypertrophy. The heart hypertrophy, why it is so, hypertrophy means it is becoming bigger, because the left ventricular, which is which push out blood to the different parts of the body. So if the heart muscles, the left ventricle is strenuous, it may get strained. If it has to reach everywhere, the blood should reach every part of the blood, part of the body. So the heart may use more power. The left ventricle hypertrophy may happen. And that time, the cardiomegaly, we can see that in PA view of chest, we can see that the heart may get becoming more and bigger. This is the early stage condition. As left ventricular hypertrophy progresses, you may experience shortness of breath. It may develop, sometimes it may develop very slowly develop. Sometimes it may develop more. If the person having tonsillitis, rheumatic conditions, rheumatic pain, and there is Ascough nodes forming in the blood vessels, that time it may grow. That time, homeopathic medicine, Spigelia, is very wonderful in rheumatic heart diseases or rheumatism of any part of the body. If I say about heart, it may, the whole part will be affected with the same medicines. We don't think that any medicine may affect a certain part. There may be written in the Materia Medica that these are the sphere of action, this part. Even though it may be written like that, if we are using the medicine will affect the whole body, will be affected with homeopathic medicines. That is why there are another symptoms may be vanished. If we are taking a medicine, we may say we give for some case, some problem. After that, the person will say that these are the symptoms I now vanish from my body. That is what homeopathic medicine. Now, shortness of fatigue, why you know that fatigue. Why the blood is not going with much nutrition? If it is not supplying the nutrition to the different parts of the body, it may get fatigue. Pain may sometimes the person may say that my fingers are paining, my legs are paining. Why? Fatigue. I may feel that my it is not strong, no strength to walk. That time trembling, and even if we walk for a few steps, they may get weak. Chest pain, often after exercising. Another symptom is chest pain, left-sided pain, numbness of the fingers and extremities. These are the, when doing some exercise or walking, that time, chest pain. Sensation of rapid fluttering or pounding heartbeats. It may call it as palpitations. Normally, when a person is a normal person, they never having a feeling of my heart is beating. If there is any problem, that time they may say that some palpitations are feeling. If a palpitation may have in some conditions of fear, panic-stricken persons, if they are doing some businessman, if they are doing a big businessman or in stock market business, money-making business, they may always in a panic position. They may have, these conditions may also produced in our psychological, maybe with the psychological problems. So if a person having some psychological problems of fear, anxiety, and everything, that time our blood may more acid formations will be there. Acidic. Our blood may get more acidic. That is why this acid formation of the blood, the acidic blood, whenever flowing throughout the body, it may damage the blood vessels. Some persons may say that I have gastric problem, lycopodium, China, lycopodium, carbovegetabilis, nexomica. These are the 4 medicines we may think whenever there is liver problems. Liver is another part, may be very much affected. There is chances of hepatomegaly, and the portal system may be damaged. And if the more acidified blood is flowing, I told you that it may damage the whole part of the body. So we can see these are the conditions. Now, coronary artery supplies blood to the heart muscles, and coronary artery disease occurs when there is a buildup of cholesterol plaques inside the artery walls. Over time, this buildup of plaques may partially block the artery and decrease blood flow through it. Cholesterol, that is why we are checking cholesterols. The cholesterol level, everything you know. LDL is, if more, there is LDL is more, that time we may say that there is chance of VLDL is more, that time it may be dangerous in some time. If the HDL is more, that time we may say that the person is, it is good. HDL cholesterol is good, but the other cholesterol are not good. But my personal opinion is the studies about these things are not fully, it is not full. We have to study it, whether this cholesterol, LDL cholesterol, HDL cholesterol, and we have to learn more, because these are the more studies should be done. The heart produces 2 major hormones, A and B type natriuretic peptides, ANP and BNP, which are synthesized and secreted in response to increased workload of the heart. Their main function is to alleviate cardiac load by decreasing the amount of extracellular and lowering the blood pressure. The atrial natriuretic hormone, ANP, is a cardiac hormone which gene and receptors are widely present in the body. Its main function is to lower blood pressure and to control electrolyte homeostasis. This hormone, two hormones produced by heart. We should not much knowledge about this functioning of these hormones, even though we may know that whenever we use Revolvia, that may reduce BP some extent. It may affect, it may produce these hormones, it may sometimes it may affect on this medicine, these hormones. So let us go to other part. Heart attack. A heart attack occurs when a plaque ruptures and forms a clot in the artery, causing a complete blockage. That part of the heart muscle that is denied, blood supply starts to die. So in treating heart diseases, one thing we should bear in mind. Calcarea floor, cactus. These are two medicines, Calcarea floor and cactus. And these two medicines, I can say, whenever these medicines are using, if it dissolves our plaques, dissolves our calcified area that dissolved, that time Silesia lower potency is also having that quality. It may sometimes get dangerous conditions. So that is why while treating the heart diseases, if we are planning, we have to give medicines only not very often. That is why doctors are saying, some experienced doctors and even Kent says in his lesser writings that some medicines should not use frequently because we should give some time. If the medicines, if it is dissolving or clearing on clot or a area, that time it may go from there, that small blocks, sometimes it may block another part of the body. So Calcarea, in such conditions, Calcarea carp is a wonderful medicine to higher potencies. Onam can be used from a important area to the lesser important area. If I say that if a small tumor of the heart, if we give Calcarea carp in higher potencies, the tumor may sometimes dissolve and it may go some lesser important parts of the body. So Calcarea carp is a wonderful medicine we can use with safety. Whenever treating with Calcarea carp, that after that we can give other medicines. Calcarea carp higher potencies are very useful, and it is not reduce the seriousness of the disease. In mesenteric lymph nodes enlargement, I used many times Calcarea carp higher potencies. Onam very frequently I use Calcarea carp daily 3-4 times. Onam. Sometimes the doctors may say that it is not fair, but I used and I get good results in mesenteric lymph nodes of the abdomen. And so let us go to classic signs and symptoms of coronary heart disease. May include chest pain, angina. This pain may radiate or move to the arm, neck, or back. Sometimes it may be you may be misled by this cervical spondylitis and the numbness of the fingers. We may think that it is due to numbness of the fingers, maybe due to heart disease or the inefficiency of the heart, insufficient heart. That may be sometimes it may be due to cervical what? Oh, that word gone. Spondylitis, cervical spondylitis. One exercise I can say, it is very good for cervical spondylitis. Can you see me? You raise your head with your both legs. Immediately you get relief. Cervical spondylitis. Do this exercise because we use collars. Why we are using collars for cervical spondylitis? The head is heavy. Don't think that head is not heavy. It is light. It is heavy. So we have to raise the head. And that time, whenever we are using the collar, that time it may support the head. And there may get some space between the cervical vertebra. That is why we are using for collars, neck collars for to get a relief for cervical spondylitis. So I told you that this exercise, we should push up our head and make a space between our vertebra. Immediately you may get the relief. We can advise the patients, and so they have to do this exercise, and we give these medicines and calcarea force, calcarea carb, calcarea force, mac force. These are all the medicines we should think. We can give it. Anyway, we can give it. It may give some relief to the person. Not all with coronary artery disease have chest pain as a symptom. Some may have signs and symptoms of indigestion or exercise intolerance, where they cannot perform activities that they normally once could. They could, but now they will be very much get tired. This is another condition, diseases of blood vessels, diffuse cerebral arteriovenous malformation, AVM malformation, diffuse of the blood vessels, diffuse cerebral or anywhere. Arteriovenous malformation is a rare disorder of the brain and defined as diffuse infiltration of brain by complex vascular structures. It is usually associated with hereditary syndrome and presented with hemorrhage or seizure. Otherwise, another one condition also we can see if there is a history of injury. History of injury is very serious. In bone cancers, there will be a history of injury. If the area is injured after long years, that may become a cancerous area. So if a person having any bone damages or bone cancer, we should ask. A few months ago, 2-3 months ago, one lady came. I have given many, two time I gave medicine for her pain in the leg. Last time I told her 2 times, if one time get no relief, I am not satisfied. I always be the first medicine. I am very much particular about it. They must get a relief. If the second time she did not get a relief, I told her to take an X-ray.
Okay, doctor, this time our participant must get their leaves.
Just one minute. I took her leg knee X-ray, and there is discoloration of the femur. I suspect that whether it is a cancer. Because I now they went after I suspect this. I told her husband, and they went. After 2 months, today came. Told me that they gone and they took allopathic medicines, and they did not find anything bad. They taken medicine and no relief. After that only, she took that medicine for last 3-4 days.
Yes.
And she got much relief because I gave her Hekla lava and another medicine. I forgot. Hekla lava and I say okay. Next time I
don't worry.
Thank you very much for hearing.
Nice presentation. It's time for discussion. Those who would like to participate can go to the participant list and raise your hand. In between, we have a short video presentation by Dr. Shamila. May I invite Dr. Shamila? Yes, please proceed, Dr. Shamila and Dr. Hubert.
Yeah.
Yes, please. Dr. Shamila, are you there?
Yes.
Yes, please. The video prepared by Dr. Shamila on the eve of our 1000-day celebrations. If possible, then please share your screen. Yes, good. Very good. Start out, please.
Homeopathy is the second most popular system of medicine, practiced all over the world. Now it is prevalent in 82 countries and is suitable for all age groups and all ailments that the mankind is subjected to, as this is a holistic system, considering man as a whole entity including the mental, physical and spiritual well-being. Homeopathy is very much related to our daily lives, helping us overcome acute infections as well as chronic diseases, and the best part is that once we switch to homeopathy, we can reduce the use of painkillers, and thus save our kidney and liver from early breakdown. Homeopathy relieves pain by finding out the triggering factors, and the presentations peculiar to each individual. In case of infectious diseases, repeated use of antibiotics damages our intestinal flora, which is essential for the proper functioning of the immune system. But homeopathy controls infection by boosting the immune process, and thus prevent recurrent attacks of infections. In the same way, allergic diseases like allergic dermatitis, rhinitis, bronchial asthma can all be cured by homeopathy without suppressing the immune system. For women, happy news is that PCODs, menopausal syndrome, dysmenorrhea, and even diseases like endometriosis and adenomyosis can all be managed very well by homeopathic medicines. With our modern lifestyle, acidity has become such a common problem. Homeopathic medicine help us control all the gastric issues like acidity, fatty liver, gallstones, piles, fissures etc. without surgery. For lifestyle diseases like diabetes, hypertension etc., constitutional homeopathic treatment, that is, medicine selected based on person's individual peculiarities and family history, helps to control blood pressure and sugar levels and prevent the development of complications. Finally, how these medicines act. Hahnemann, the founder of homeopathy, proved that any substance that produces symptoms in healthy persons can remove similar symptoms in the sick. He at first used crude forms of medicine that caused aggravations. Then he reduced the dose by continuous trituration and succussions, a process of constant friction, leading to the production of nanoparticle. In 2010, a group of researchers in IIT Mumbai found out the presence of nanoparticles of starting substance in the homeopathic ultra-high dilution. Thus, homeopathy can be regarded as 200-year-old nanomedicine. Now it is up to the scientific community to prove the mechanism of action of these nanoparticles at the molecular level. Homeopathy is the medicine of the future as it is the cheapest, safest, holistic, individualistic and eco-friendly medical system that the future generation demands. International Forum for Promoting Homeopathy is an organization working towards creating awareness of homeopathy among public, as well as educating, updating and integrating homeopathic doctors all over the world. Congratulations to Ifph for successfully conducting 1,000 days of webinars.
Yes, thank you, Dr. Shamila, for preparing such a wonderful video and beautifully presented, even though she is sharing the screen first time. Well done, Dr. Shamila. Thank you for active participation. Yes, that's all. Dr. Hubert, if anybody would like to participate, you can. Yes, those who would like to participate or communicate with Dr. Hubert. Anyway, this is a nice presentation. Even though these are the basic things, yes, it of course needed some, always we need some refreshing all these things. After 25, 30 or 40 years, definitely you have to need some refreshment. And what you have done is, yes, Mr. Hamad Hassan, definitely it will be shared in the IFPH international group as well as the national groups. Thank you. Now, Dr. Gopalakrishnan is there. Yes, sir, please, you can unmute now. Yes. Welcome, sir. Yes, sir.
Sir,
Please
unmute. Sir, you unmute, sir.
Yes, please unmute, sir. You are muted. Please unmute, sir. There's a, you can unmute. Yes, good.
Yeah,
Okay.
yeah, okay.
So, with regard to the explanation and class on diseases, I have got some opinion. That is, I am Dr. Gopalakrishnan, former associate professor in community medicine in public health. I am a heart patient, and you have mentioned about various problems of heart diseases, and I have got a valve problem that you have mentioned. Both valves are stenotes. Both aortic valve as well as mitral valve have got stenosis problem. And in 2017, Sri Tirunal Institute have given date for surgery. And in allopathic system, there is no medicine for stenosis problem. Only they will control blood pressure, and for which amlodipine and ecosprin will be given. And with this time, I approached the homeopathic doctors, and they have given certain medicines, and I adopted very systematic life regularly, and now I feel okay. And formerly, when I was walking in early morning, as you have mentioned, there was numbness to the left extremities, left fingers, but now it is not there. And anyway, I am going with in good condition, especially with regard to my day-to-day life with homeopathic medicines and my routine life. And have you got any specific medicine for that? And not for using that medicine, but have you got any opinion for controlling this stenosis? And according to allopathic system, this is a somatic problem which cannot be corrected by any medicine and without surgery.
Yeah, calcarea floor, calcarea carb, cactus, spigelia itself.
Spigelia,
cactus, calcarea floor, and these are the medicines.
okay.
We can use, in addition to that, you can use cratages. Regularly, you can use.
Which one?
Cratages.
Crataegus.
Yeah. Mother teacher.
C-R-A-E, Crataegus.
Crataegus. Okay.
Yes. I think Oromet is also a wonderful medicine for that.
Yeah. Oromet. Very. Oromet one.
Then this lithium carb Leading is another medicine. Calmia is another medicine. A lot of medicines are there, sir.
Lot of medicine. Regularly in the morning, early morning, before 6 o'clock, what I am using is Diaca. Diaca.
Adiac, which one?
Diaca.
Diac, okay. Yes, of course, homeopathy is definitely a wonderful system of medicine which can provide a lot of handful of opportunities out there. That is a peculiarity. We have hundreds of medicines for different conditions. That too, the proved medicines, proved in healthy human beings, exactly proved with dedication, not with commercial aspects or commercial eye, or not for producing any, making any kind of profits. Not at all profit oriented. It's a classic work. That is why we can use the medicine even after 250 years. Nobody can imagine that. Moreover, the methodology of preparation of homeopathic medicine is scientific. So each and every medicine has got its own precision. These are not at all the combination of medicines. Just like the Ayurveda, they are yoga. According to different textbooks, different type of medicines can be there. But in homeopathy, if you purchase Rustox, every medicine will be Rustox. If you buy Pulsatilla or Crataegus, each and every sample is exactly the Crataegus. That is the precision of homeopathy.
In another medicine, Pulsatilla. Pulsatilla 30 is a good medicine for stenosis, remove stenosis. But we can use Silesia lower potencies, but it is, I think that in Sirabar 3 potencies are good for Silesia for removing stenosis.
My doctor prescribed Silesia in high potency one drop once in 30 days.
Yes, that is more logical, sir. Yes, of course. And you have done a wonderful job, definitely, sir. Usually what happens is that a lot of persons are taking this medicine that they will not admit it. But persons like you, as Haniman said, dare to be wise. Thank you.
Audio sapia.
Yes. Okay, thank you very much. Yes. If anybody would like to participate, we have 2 minutes remaining. Hariram, sir. Yes, sir. Please unmute, sir. We can unmute now, sir.
Okay, yes. Doctor. I have just ended. That's all. I have no opinion. Just ended only.
Okay. Yes. Newborn baby is there. Okay. That's also one thing. Now, Ahmad Hassan, sir. Yes, sir. He's also very eagerly watching all these things. Yes, sir, please.
Good evening, sir.
Good evening.
Pointed about the cholesterol, HDL, LDL, and VLDL. So HDL regarded as a good cholesterol and LDL as a bad cholesterol. It is in general language for information. But sir, if all lipids high, then it is give problem to the patient, because triglycerides, cholesterol, and other apolipoprotein all are high, then it will be causing problem to the patient. But if only one high, cholesterol or triglycerides or any other lipids profile, then you have to take preventive side, and it is better. Because there was one my doctor friend, he was having 1000 cholesterol. Cholesterol only, but triglyceride, everything is normal. We are colleagues, so he used to come and he follow a very good diet, and after about 2 years, his cholesterol came normal, about 250 something. It is near to normal, So nothing to worry if one is only high, but be careful. Thank you very much, sir.
I have seen that many some persons having all the diseases, but they will live normal life. Sometimes some persons having only one disease, but they living abnormal life.
There we must perceive the presence of miasm. In case of this psoriatic miasm, the cardiac neurosis, they are very much distressed, having a lot of symptoms, but they will lead a safe life with all these worries. And for the otherwise, if they are a psychotic persons, they will not have any symptoms, but suddenly they collapse and end in death. That is the presence of miasm. That's an important thing. Anyway, trying to wind up session, may I invite Ahmed Hassan sir to express a lot of thanks. Sir, please.
Thank you, sir. Dr.
Thank you.
Hubert, sir. And on behalf of Ifph, our learned senior doctors, as well as respected participant, I extend my gratitude to you, and I hope that your platform and you are also active participant and always try to contribute knowledgeable things to all of you. May Almighty bless abundantly. Thank you very much, sir.
Thank you, sir. Thank you.
Yes. Okay. With that, we come to the end of today's English session. Hope you to meet the same day tomorrow. Till then, goodbye. And it is of Dr. P.K. Shaila to continue the program in Malayalam.